All right. Good morning, everyone. I think we have enough people on the line so we can go ahead and get started. I believe, Alan, you have already started the recording, so thank you for that. I just again wanted to welcome you to the revised MnCHOICES MCO and MCO Delegate Agency call-in session. My name is Rakia Banya, and I am one of the MnCHOICES policy leads. I'll be presenting on the first few slides, and if you would like to follow along with us, you can visit the MnCHOICES Partner Link page, select Training in the left navigation menu, and click on the DSD Webinar Training Archive link. And then when you select MnCHOICES, you'll find the PowerPoint for today's call. So it is already posted on the DSD Webinar Archive page. So here's a list of additional policy staff who are on the call with us today and will be assisting with answering some of your questions. As a reminder, this session is being recorded. We will not be using the chat or Q&A feature, so if you have a question, navigate to your reactions icon and raise your hand. We will unmute your line in the order you raised your hand. But however, if you have any technical issues, please let us know by using the Q&A feature. So here's our agenda for today's call. We plan to cover a few items, and then we'll allow you to ask MCO-specific questions that are related to the MnCHOICES application. Okay, so on slide 5, so yesterday an email went out to mentors notifying them of a new enhancement that will be added to the system on Friday. So our August release is on Friday the 23rd. This workflow was created for MnCHOICES assessment and support plan for a person who is enrolled in managed care and on a disability waiver. So the new functionality will eliminate the duplication of work for county and tribal nation staff. So when you're creating a MnCHOICES assessment and you navigate to the question that I am the care coordinator and need the staying healthy section, you will now be provided with 3 response options. So you'll see the option of yes, staying healthy only, yes, staying healthy, notice of action and signatures, and then a no selection. And so we'll look at those response options in more detail. Okay, so for slide 6, so you'll select yes, staying healthy, notice of action, and signatures. If you work for a county or a tribal nation and you're fulfilling both the care coordinator and certified assessor role, when you select this option, the staying healthy section will populate along with the notice of action and signatures. So on the next slide, when you select no for this question, you'll select no if you're not the care coordinator. So you wouldn't be using the staying healthy section, but then you'll see the notice of action and signatures populate as additional sections throughout your MnCHOICES assessment form. If you're both the care coordinator and the certified assessor, and you're completing work on behalf of an MCO, you'll want to select yes to the staying healthy, yes to staying healthy only. And so selecting this option will give you the staying healthy section, but it won't populate the notice of action or signature section in that form. And if you want to know more information about this new enhancement, you can again reference the communication that was sent out yesterday afternoon, or you can reference the MnCHOICES assessment content module, which is the Functional Assessment Staying Healthy module that was updated with this change. Now I believe I'm going to pass it over to Liz, who will present on the next few slides.
Thanks, Rakia. This is something that we wanted to address with you all. We have gotten a lot of questions stating that people are receiving a case mix A and when it should really be a case mix L on their assessment results. This has always been determined to be the way that a person is answering the choice to stay on or return to a disability waiver. What I see most often is people are choosing person is 65 years or older and all the following conditions are true, when what the answer really needs to be is not applicable, not choosing to stay on or return to a disability waiver. So we're just requesting that people read that question very carefully. It's in the informed choice section of the MnCHOICES assessment. I will note, even though that we are presenting on this and we're wanting people to be careful about the choices they're making, we're actually updating this area very soon in the next couple of months or towards the end of this year. So it'll be a little bit more clear. But in the meantime, if you can review that question carefully, ensure that if you're over 65 and you're not returning to a disability waiver, that the answer is not applicable, not choosing to stay on or return to a disability waiver program. Next slide, please. The other thing that we wanted to talk about today, we had questions in the beginning, especially about how to determine which type of special needs basic care a person is on. Not all of these slides will be applicable to everybody in the audience today, but we wanted to present on them because they'll be useful for at least some of you. So this first slide is the first main way you're going to try to determine what type of PMAP or what type of SNBC specific program somebody is on. This is a picture of a person's record, the health information icon, and then specifically the health insurance tab. It will either say SNBC non-integrated, which is pictured here, or it'll say SNBC. When it says SNBC, that is referring to Integrated Special Needs Basic Care. Next slide, please. The second way that a person may be able to determine which type of SNBC a person is on is if they have access to SSIS. So this is generally our MCO county delegate staff. In SSIS, if you go to the healthcare eligibility from MMIS tab and click on the caret by PPHP data, it will either say Integrated Special Needs Basic Care or Special Needs Basic Care. This is the opposite of the last slide. So if it just says Special Needs Basic Care, that is referring to non-integrated. There are also numbers associated with it. So if you look at the product, it will say MA17 for Integrated Special Needs Basic Care, or MA37 or IM37 for Special Needs Basic Care non-integrated. And this is why we also provide the slides, because we know this might be a little bit confusing and you might want to have this information on hand if you're using these systems. Next slide, please. This next way also is more applicable to our MCO county delegate staff. This is an MMIS. There are two different screens that a person might want to check. The RSUM screen, which is the first SNP, that will only give you the numbers under product ID. In this slide, you can see that it says MA37, which is SNBC non-integrated. It may also say IM37, which is the same SNBC non-integrated, or it will say MA17 or IM17, which is Integrated Special Needs Basic Care. The other page is a little bit easier to tell. It's the RPPH screen. It will also have those ID numbers, those product ID numbers. but under the description, it will say integrated or non-integrated. So much easier to see on the RPPH screen. Next slide, please. Next, we wanted to talk about completing a reassessment. We've said different things about the support plan in the past. So we wanted to just talk about the assessment process and the support plan process at reassessment time. So for the assessment, when you go into the initiate assessment screen, the first screen you get in an assessment, you're going to choose current recipient / reassessment. The assessment type is reassessment. And then you have the option to choose whether or not you want the existing assessment information to copy over. You have the option of choosing yes, you do, or no, you do not. After you select that, then you'll have what I refer to as cover sheets for each functional assessment domain. And that is where you would check off that you reviewed those subsections and updated them. Currently, there are also lines in each narrative field that says copy from previous assessments, so you know that whether or not you updated them. Next slide, please. So this is something that we haven't talked about as much, and it is the support plan at renewal. In the past, we have said that if there's a new assessment, you create a new support plan from scratch by adding a new form and selecting annual / reassessment. We do have another way that you can complete a support plan at renewal, which is revising your current support plan as long as it's in an approved status, actually approved by MMIS specifically. And then you can click revise and hit annual / reassessment. When you revise your support plan and create a reassessment this way, the information from your last reassessment will copy over. And once it's in progress assessment complete, the information from the new assessment, so long as that new assessment is in an approved status, will flow into the reassessment support plan. The only thing that clears during a reassessment support plan are the dates of services, so you must re-enter them, and the rates, so you need to rerun the rates. And then that's what it says, no rate puts and dates. All the narratives will come over. So this is similar to the assessment where you choose, yes, I want the information to copy over. When you're using the revise function, that's essentially what you're asking the system to do. If you use revise, it copies over. If you create a new plan, nothing copies over. Next slide, please. We also sent an email to mentors about the new process for documenting assessment time. We are reusing the screens that you can see in this snip here. It says assessment interview time and hours and minutes. DHS has been working with the county state work group who has asked that we include additional time in this. In the past, we have given the recommendation or the requirement that this is just the assessment time, the time you've spent talking to a person, but now we have additional criteria. The PDF was sent out in that email, and it is also located in the Help Center, but I am going to share my screen and show it to you again now. Are we seeing this?
Yep, we can see it.
Okay, so this is the PDF that's in the Help Center MnCHOICES assessment track completion time. It gives you a little background information about this and policy. It shows where these fields are in the activity information section of the MnCHOICES assessment. and then specifically what's included. So we are including intake activities now, the time it takes to gather a person's contact and general information, collecting information about the referral, understand why they're calling to request an assessment, diagnostic information, health insurance information, giving the person information about MA eligibility, and then almost all parts of the assessment, reviewing the information you need, actually scheduling the appointment, arranging any special accommodations, which might be an interpreter, and then the actual face-to-face time that it takes to conduct the interview, and completing eligibility worksheets if you need to do that, if they're on AC, ECS, consulting with others about it, and then completing your assessment. We're also including travel time with this, and any other information that a certified assessor or case aide might need to do, like preparing the packet if there is one, updating their demographic information. And then we list what is not included. So what's not included is anything related to providing documents related to MA eligibility, helping them complete the eligibility process for medical assistance, verifying income, Social Security number, and citizen status, SMRT process information. So these are those financial, these external criteria, not related to the assessment, not related to what a certified assessor can do in the MnCHOICES assessment. And then we have some additional links. Kia, do you want to share your screen again? Thank you. Next screen, please, or slide. We also wanted to talk about new current functionality document item. This is something one of you brought to our attention, which is if you're working in an assessment and you forget, or excuse me, if you are working in a support plan, an MCO support plan, and you forget to type in the date that the support plan was shared with a primary care doctor or a team member, or if you're in the HRA and you select the HRA support plan and you select no, or you do not enter a date, then if you close that out and revise the support plan, it will not save the date. So you are not able to enter and save a date that the support plan was shared with a primary doctor or a support team member. At this time, we are requesting that this be handwritten. This is slated to be fixed next month. That's always subject to change, but we are working on getting this CFD defect removed. Next slide, please. All right, I'll pass it back to Rakia.
Okay, so now it's time to answer some of your questions. So at this time, I'm going to ask that you use the reactions icon to raise your hand, and we will call on you in the order you raised your hand. So I do already see a few hands raised. The first person I'm going to call on is Carrie. Your line is unmuted.
And updating goals at reassessment.
Carrie, I believe we heard when updating goals at reassessment. I didn't hear the rest of the question unless someone else did on the team.
No,
Could you, yeah, it was just, could you go over the process or the workflow at reassessment time of updating the old goals in the old support plan and then doing the reassessment?
Yes, so at this time, oops, I have some feedback. Thank you, Rakia. At this time, our direction is to update the goals and the progress, anything that you want to do on the support plan prior to completing a new reassessment. So at this point, we want you to be updating all of that prior to starting a new reassessment. You could still do that if the assessment is in progress, but because you start a new support plan at the same time, as part of your workflow, we just really want all those updates to be completed prior to a new assessment and support plan being started. We know this is causing some difficulty for people, and we are working with our vendor on trying to find a better workflow process at reassessment time.
Okay, the next person I'm going to call on is Angela Dostal. Your line is unmuted.
Regarding the collection of the data for intake, assessment, etc. How are we supposed to address that as counties when we have multiple people in the agency doing multiple roles that do not necessarily have access to MnCHOICE's revision? Is this just the information from the assessor, the time we spend on it, or our whole agency?
It is agency-wide, and it is up to the agencies to determine the best workflow process for that. Intake staff can record the amount of time it took for them to do their piece and then provide that information to the certified assessor, and then you would add that time together.
Okay, it looks like the next person is Carrie. Did you have another question? I'm going to unmute your line. Okay, I see she lowered her hand. So then the next person I'm going to call on is Ricky Vang. Your line is unmuted.
Clarify, no, in the reassessment under plan revision, it had said that no rate inputs and dates would come over, and I just wanted to clarify, so that would also be true of like an EWRS rate plan from the previous year, so none of those would come over either, and you'd have to re-enter that?
That's correct.
Perfect, thank you.
You're welcome. I do want to mention though, even though the rate inputs don't copy over, all of the services that you had previously authorized do come over, including the provider. So there is still some work left to do, making sure that the RS tool is updated and accurate to reflect the new year and the maybe the new assessed needs. But at least the services, the providers are all being copied over.
Okay, the next question comes from Jennifer Redman. Your line is unmuted.
Patty, are the disability waiver case manager at the county using the MnCHOICES assessment along with as a part of the HRA for the MCO? I'm thinking about location and assignment. When they go in right now, they have to pick UCare or they're signed in as UCare. So is there instructions on what that role, when they're using the combined assessment, will put for location and assignment? And I'm also wondering about reporting, if there's been updates on how this change will affect reporting for MCOs, if they'll be able to pull reports based on assessments and assessment timelines and things like that, if they're signed in as a county case manager.
Yeah, I don't know if we'll need to take that question back to have further conversation on how that impacts reports that's based on how the user is signed in. So we'll need to take that one back and look at further just testing of how that would actually look in the system based on the role that the user is signed in under. But thank you for your question.
Okay.
Okay, the next question comes from Trista. Your line is unmuted.
I have a question about the slide where you indicated at reassessment, we should select that a person is a current recipient and that it's a reassessment. I believe we were originally instructed to always select not current recipient. So that's what we have been doing. Before we did that, when we selected reassessment, there was some sort of MMIS entry issue with the reassessment code that comes up. So I was just wondering was there some sort of fix maybe in the system that now we do select current recipient rather than not current recipient?
Are you talking about for people who are on waivers, or are you talking about state plan service specific?
I'm talking about like PCA, yeah, state plan.
Okay. State plan, I believe, is still, you still need to choose initial. It's in our
Okay.
CSM. We don't have any of our home care team here. So I don't want to speak out of turn, but as far as waivers are concerned, this would be the process. But if you do have any
Okay.
questions about state plan specific, I'd encourage you to write that in. I don't want to speak on their behalf.
Okay, I just wanted to clarify that so
Yep.
so we didn't start doing that.
Yeah, thank you. Thank you for clarifying that. This is just for waivers. This is a waiver process.
Yeah. I did miss like the first 10 minutes, so I don't know if you addressed this, but this new information that just came out about how individuals who are on managed care and also on a disability waiver, like how we're reducing duplication of work. It seems like in MnCHOICES, I didn't really fully understand everything that was mentioned in there, but it seemed like the announcement didn't really address how we work specifically in our agency, where we have case managers who are not care coordinators. So the case manager, say the DD waiver case manager is separate from me, who is the managed care coordinator. So they're opening their assessment and support plan, and I'm opening my assessment and support plan. Is that process still the same?
Yeah.
How we're doing it, because here in our county, the case manager would not ever use the staying healthy section because they're not the care coordinator.
Right. And so, yes, you would still follow that same process if you have separate roles, but this is for if the user is kind of they have that dual role where they're a certified assessor and the care coordinator or the case manager. Then it kind of eliminates that duplication. But if you have separate roles, then you will continue to follow the same process you have been.
Okay. Okay. Thank you. That's all my questions.
Thank you. Okay, so then the next person I'm going to call on is Marcia. Your line is unmuted.
I had a question about this same item as well. So for MCO care coordinators that are not waiver case managers, right? If you're just doing the HRA MCO, does this option even come up, or like which option should we be checking?
Yeah, so if you're just doing the HRA, this option, so I'm sharing my screen, I am the care coordinator and Eat the Staying Healthy section, is only a question that's in the MnCHOICES assessment form. So if you're
Okay,
completing
great.
an HRA form, you won't see this question and you'll continue to complete that form as you have been, so that it's completely separate.
Okay, great. Thank you.
Okay, the next question comes from Ruth. Your line is unmuted. Sorry, I think.
You would
Okay,
still,
Ruth. Okay, can you start again with your
okay,
question,
sorry.
please? Thank you.
Okay. So I just want to clarify this process that you actually have the slide up on. If we're the EW case manager, care coordinator, we would just use the staying healthy only, correct? Where versus if they were on CAT, CADDY, BIDD, then we would use the staying healthy notice of action and signatures. Is that correct?
That is correct. Yes.
Okay.
So for EW, you'll just continue to do the staying healthy only.
Okay. All right. Thank you.
Thank you. Okay, the next question comes from Katie. Your line is Katie Pinkert. Your line is unmuted.
When you do a revised support plan and you open a revised support plan and assessment at the same time, can it still carry over, or do you have to open the revised support plan after the assessment is completed? Or can you do it at the same time, wait till it's completed, and then hit submit like you do now?
The process is the same as now. And so one thing that I think people maybe haven't been doing as often because we have a defect is waiting to change the support plan from in progress to in progress assessment complete after the assessment is in an approved status. That's a very important step that I think sometimes has gotten missed because it was discovered that information is still pulling through, even if you don't follow that step, but it is best practice. You can open them both at the same time, that's not an issue, but you must leave your support plan in progress until your assessment is in a completed status.
Thank you.
You're welcome.
Okay, the next question comes from Marcia. Your line is unmuted.
I already asked my question earlier. Here, let me lower my hand.
Oh, okay, sounds good. Okay, so then the next question I'm going to call on is Marissa. Your line is unmuted.
Yes, I just have a question on the transfer guide document for MSHO MSC Plus Care Coordinators. Is that still in a draft form? Because we have one MCO telling us to follow that, and we have another MCO telling us it's still in a draft form. So we're having to use two different ways to complete them. So wondering if it's approved or not.
Well, it is in a draft form. We have also told MCOs that they can start using it if they want to. So it sounds like you work for more than one agency and
Correct.
yeah. So that has been something that the MCOs have chosen to use or not use while it's still in a draft. But
It will come out of the draft form, so all MCOs feel comfortable to use it.
yes, it's going through our plain language review right now, and where we will put that in the help center as soon as possible.
Thank you.
You're welcome.
Okay, the next question comes from Amanda. Your line is unmuted. Question about how to code the assessment, and it is an initial assessment. did anyone else understand the question?
Well, it wasn't a
Um,
question. I was just following up on that PCA piece because you didn't really know for sure. But that's what you were thinking, was it needed to be coded as an initial assessment in revision, and it does.
Oh, yeah, sounds good. I think that's what, yeah, Liz was saying. Yep, for the initial assessment for PCA, you would continue to select initial. Yep. Thank you for that.
Oh, absolutely. I've been doing a ton of them.
Okay, the next question comes from Kim. Your line is unmuted.
Yes, I believe this question was asked in the past, but I want to just get some clarification on it. If the care coordinator is unable to get a signature from either the member or a provider, when the member asks to share the care plan, get the signature from a provider, does DHS have any guidance on how long the support plan should remain open without a signature from either the member or the provider?
Do not have additional guidance at that time. At this time, the requirements are that they need to be gathered, and we don't have any exceptions from CMS on that at this time.
Okay, so it could remain open and then all of a sudden a revision comes and they still don't have a signature?
If those things are happening, you'll have to just write them in and ask for guidance, but we don't have an exception process at this point.
Okay, thank you.
Mhm.
Okay, the next question comes from Kristen Rhodes. Your line is unmuted.
We just recently encountered a situation when we were doing some validation and reviews of assessments where an incorrect date was utilized for the assessment date. It was left as last year's date. And so we have concerns over reporting for that for a couple of things, and would like to, I guess, be reminded if there's specific guidance that there has been about that as to what to do. I think the reporting issue that I have is that, or that we would have, is that the MMIS entry, quote unquote, I know they're not entering it into MMIS, but that data would be going over to that system with the incorrect information. And so in our current system, we are able to create a new one and it copies forward everything. And then we just void the one with the incorrect date after the new one is corrected. Would that be the same guidance, or does that do anything for the system? And I'm calling out that this could be potentially in an MCO HRA, or I think that's what we're encountering currently. Or what if it's in a MnCHOICES assessment? What would be the guidance for that?
Sorry, my mouse didn't want to move very well there. I just want to paraphrase what you said back to you to make sure I'm understanding. Are you saying, I'll speak just to the MnCHOICES assessment piece, but are you saying that the activity date in the actual assessment was a year earlier than it should have been?
Yep, I'm trying to pull up my notes to see exactly if they said it was an HRA assessment, like a MnCHOICES assessment or an MCO, or if it was for an actual HRA MCO. And so I have thought that I was saying it one way, and then as I was speaking, I was maybe thinking and contradicting myself. I think it is just MCO HRA because it was for a community well member. So in that case, it would not be MnCHOICES assessment. So thank you for helping me or letting me research my.
So I'll let Rakia try to address that because it sounds like just a reporting piece. I do want to say, and I'm glad that it's not the assessment, because it would be very hard to do because the dates don't carry over. So and there are rules in place on the assessment where dates can't be before one another. So they would have had to enter
Adjusted at
4
some point.
dates incorrect.
Yeah.
So Rakia, she is asking about an activity date that the HRA was completed and what they should do in those situations.
So the date that was entered was incorrect?
Yes. So we have an instance where it was identified that the activity date or assessment date for the HRA is not the correct date. It was the previous date, like it didn't get changed.
So right now, we don't have the ability to reopen an HRA form to correct the date. We did submit that as a future enhancement that I believe is slotted for one of the upcoming releases. But when it is released, users would have the ability to go in and reopen an HRA form for those minor edits to, like, for instance, correct the date. But right now, since we don't have that functionality, the only thing we advise you to do is create a new HRA form, and then everything copies over from that prior form to the new form, and then you can change the date or update the date, and then again mark the assessment as completed, so that that last HRA form has all the right information and all the correct dates identified.
Okay, yeah, and that's ultimately what our process has been or was in our internal system. But I just didn't know if that would throw anything off. And so I think it's less likely to when there's obviously it's not the MnCHOICES assessment, right? But it's just the HRA. But then would that show as, I know people have asked about, reporting purposes, right? So would both of those ultimately show upon reporting, and somehow we would need to determine which one was accurate and not accurate when that reporting comes through? Or has there been any thought around any of that? Because the other one would still be there, but it would be now invalid, but not necessarily like discarded, right?
Right, yeah, it wouldn't be discarded. It would just show that an assessment was completed, but they're really looking at that top one, the latest completed or the most recent completed HRA form.
Yeah.
And I believe it's that one that would be, I don't know, I don't want to really say it, but it's kind of marked as active because it's the last one that was completed in the system that has that status of completed, and that's the one that they will be looking at.
Yeah, okay. And so if we were concerned about it before the end of the year, and I know I sit on one of the input groups and approval groups, so I would have to, I guess, go back to see like how that was related necessarily, maybe the verbiage of how it was kind of said to me and what is on some of our fixes. I would just need to kind of relate those, but I guess, would the overall guidance be to wait until that fix can happen, or that people really should be fixing it as soon as they are kind of identifying those?
Yeah, I would say as soon as they're identifying it, to go in and fix it just so that it's accurate information.
Yep.
But I do know the fix has been in the queue, and I want to say it should be coming out in one of the upcoming releases. So they can expect to see that change soon, but I think in the meantime, they should go in and create a new form so that that form that's completed has all the right information with the correct dates.
Yes, thank you.
Thank you.
Rakia, I just want to add that I'm not sure if we've determined permission levels for reopening. And so it may just be admin staff, but we'll provide more information when that function is available about who can do it, who has the permission to reopen an HRA and support plans.
Yep. Okay, Amanda, do you have another question? I'm going to unmute your line.
Oh, sorry, I forgot to take it off of there. Thank you.
Yeah. Okay, the next question comes from Justin. Your line is unmuted.
I was wondering about, so we've had some issues where we have staff leaving, and when we do create a new care plan, a support plan, we have the previous care coordinator information pop in that line of what care coordinator completing the HRA or care coordinator completing the support plan. Is there a workaround to remove that? So when I update, so I add myself as the new care coordinator in there in line to try populating my information in there, but it won't do it. Is there a way to remove that care coordinator, or do you want us downloading the support plan as a document we send to the member, just editing that information out and putting the updated care coordinator's name in there?
Yeah, the easiest workaround at this point is just to cross it out and write your name. This is another item that we've asked for an enhancement, so which is slated to come also in the next couple of releases, where you will be that field is now going to be part of the requirements that you have to select the person, and therefore it will be editable based on staff assignments. So if you're listed as a case manager, care coordinator, or support staff, that is something that can be populated in those fields and changed.
Okay. So we'll just keep at this point. We'll just keep doing what we're doing right now. Is just edit it, send it to the member that with your correct information on it.
Yes. Yes. Thank you.
Yep. No problem. Thank you.
Okay, the next question comes from Naria. Your line is unmuted.
Just wonder that I registered for the 101 training, which is HCBS. Is it the same course? This is more about the case coordinator? I'm just wondering about it. Can you guys hear me?
Yeah, I think we can hear you, but I'm going to ask if you can repeat your question. You were wondering about one of the training courses?
Yeah, for the to enroll to give the as a provider, they require to get 101 training, which is home community-based service, waiver and alternative case provider training. Is it the same training that I'm in, or is it different? Because this is more about the case coordinator that I hear. Am I in the right place?
Yeah, this is for care coordinators. I am not sure what you would do as a provider. We have a different department that works with provider enrollment.
Yeah, I'm on the wrong place. I knew that. Thank you.
Welcome.
Oh man.
Okay, so then the next question comes from Jody. Your line is unmuted.
Answered a couple of times ago, but I want to just verify. When a MnCHOICE assessment has been completed and a care coordinator has been assigned for a waiver, and then I come in and do the HRA, and in the support plan, the care coordinator shows up as the waiver care coordinator, and I'm not able to change that. So would that be the same, that when that enhancement comes through, that it'll take care of that part as well?
That's correct.
Okay, thank you.
You're welcome. Yeah, so if people didn't completely catch on to that, there are 2 areas in the MCO support plan where case manager, care coordinator populates, and so we've asked for enhancements to both of those areas, and as well as the HRA support plan.
Okay, I'm going to unmute Justin. Do you have another question?
Oh, No, I don't. Sorry.
Okay, sounds good. Thank you. Okay, so then the next question comes from Jennifer Redmond. Your line is unmuted.
Thank you. I have another question about when the like a caddy or disability waiver case manager is a dual role, and they're doing the one assessment for a member who is also on either Connect or I'm sure what have you. What if when that member perhaps transfers to another agency, non-county, who's not a dual role, perhaps an MCO delegate, will that receiving care coordinator be able to access the full MnCHOICES assessment and support plan as a non-certified assessor to revise it or update it during a transition?
They won't be able to, if they don't have the certified assessor role, they won't be able to edit the assessment, but they will be able to view what was entered or completed for the assessment. Is that what you were asking?
Yep, that was part of it. And the support plan? Will they be able to revise that support plan that's created off of a full MnCHOICES assessment as a non-certified assessor? Or create an FNU even?
Yes.
Okay.
Yes, for the support plan, but only certified assessors do FNUs for.
Oh,
So they
true.
would,
Thank you. Yeah, thank you.
so they would need that role. Yeah.
FNUs for EW.
Yeah, I was just thinking it could happen either on MCHO or SNBC that a caddy case manager has a dual role and the member gets transferred. Could be
Sure.
either situation, but
Yeah. Thank you.
Okay, the next person I'm going to call on is Jody. Your line is unmuted.
Oops, I'm sorry. I'll put my hand down.
Okay, so then the next person I'm going to call on is Sarah Norquist. Your line is unmuted.
Sarah from Health Partners. I am wondering if you could clarify when we're having members transfer to Health Partners from the county and just trying to shift that case. We can transfer from MCO to MCO, but we're not able to transfer from MCO to county. And I was trying to follow the guidance doc from the help desk. And it's a little confusing. It's, it says on here to create a discharge if the person's no longer eligible for or chooses not to use publicly funded home and community-based services. But if I recall, that's how we were advised to discharge the location if county was assigned to get that if they haven't discharged, and we need to get our care coordinator, our location assigned so we can do our work. Can you just clarify if I'm on the right track there or what we should be doing?
Are you talking specifically about assignment in MnCHOICES during a transfer?
Yes, correct.
Oh, okay, and I'm sorry, can you repeat the question?
Yeah, so when
and it has to do with MCO going to a county specifically?
Or vice versa, the location assignment when
Okay,
it comes from the county to the MCO.
okay. And I'm sorry, and what is the question?
So currently what we're doing is when we get those cases and we've confirmed all the information, like all the forms are complete, the staff has been unassigned.
Yes.
Oftentimes the county isn't, like the location is still assigned, so we're going in and discharging the location versus transferring because transfer isn't an option from MCO to county.
Oh, okay. Can you write that in? We have somebody that works specifically in that area.
Yeah, I can do that.
Thank you.
Thank you.
Okay, so then the next question comes from Ricky Vang. Your line is unmuted.
Thank you. I know we had discussed this multiple different times, but I think there's been some conflicting information or perception of the information that has been communicated. And this particularly has to do with care coordinator change screening documents. So we had been previously informed that if we are doing a revised MnCHOICES assessment to determine eligibility for programs such as PCA or EW, including functional needs updates for the replacement of activity type 10, those would be entered into the revised MnCHOICES application. And of course, there was a big, emphasis on making sure that the care coordinator's information was attached to the member with the care coordinator change screening document. Is that still true for those on EW and those on PCA or, wanting to access either programs in addition to the activity type 10?
That you need to enter that that additional document, that administrative LTC screening doc to update the care coordinator name?
Correct, yeah. Because I
Yes.
think in another training we had been told, well, if it's related to EW, but we also recognize there's people who might say, I want PCA services, you go out, you do PCA, they are quote unquote eligible for EW, but they don't necessarily want it, but they might want it at a later time.
Mm-hmm.
And so it could turn into an elderly waiver open at some point within the, eligible time frame of 60 or 90 days. So we just wanted to make sure we clarified that care coordinator change screening documents should be entered for each of those scenarios. So whether it's a PCA, EW, and or functional needs updates attached to any, of those, like the EW one, that we would be entering in a care coordinator change screening document.
Yeah, if there's already a LTC screening doc in the system, then you would enter it.
Thank you.
You're welcome.
Okay, the next question comes from Sharon Oliver. Your line is unmuted.
We have had situations where assisted livings have requested changes to like a support plan or excuse me, not a support plan, an RS tool that we had completed in a legacy document. But now that we're all in the revised MnCHOICES, we cannot seem to get the rate tool to work in the MnCHOICES when we just want to create a rate tool unless there had been an assessment in MnCHOICES. Is there a way to be able to update that assisted living rate tool in the revised MnCHOICES without an assessment?
Yes. This is when you would use a transition plan. So we have a smart guide in the help center that is specific for transition plan reason, and it tells you how to do that, and that is the exact scenario you would use it for. So you can only have a transition plan support plan when there's no assessment, and that takes away the rules and requirements to have assessed needs pull over. If you were to add a support plan that isn't a transition plan reason in the revised MnCHOICES without an assessment, you would not be able to complete it or complete the requirements because it relies on assessment information.
Thank you.
You're welcome.
Okay, the next question comes from Angela Dostal. Your line is unmuted.
I'm not sure if anybody can answer this question, but going back to like the question about the wrong care coordinator coming through, we have the right care coordinator coming through, but the phone number is wrong. And I've checked their record in the revision, and the phone numbers, when I look at their actual record, is correct. So where is that number pulling from, I guess, is my question.
We would ask you to send that in, especially if you've checked that person's record and the phone number is correct.
Okay.
Yeah.
And where exactly are you seeing the phone number?
I would have to go back into the document. She
Okay.
asked me about this like a month and a half ago, so.
Yeah, are you
Okay.
talking about the person's phone number or the care coordinator phone number?
Well, it appears to be the care coordinator phone number, and it was in the support plan where it was coming through. But like I said, the number that's pulling through is not attached to us in any way. I don't even know where it's pulling from.
Yeah, you might want to go ahead and send that in. It might be pulling from the organization, and the only person who can change the phone number for the organization is, I can't even think of what role that is. Liz, unless you know, but if you want to send that in, we can definitely take a look at it, but it might be coming from the organization profile, but not everyone has the ability to update the phone number in the organization profile. You might have to have your supervisor or someone look into it to update that number, but send it in and we can provide more guidance.
Okay.
Yeah, lead agency admin role.
There it is. Yeah, yeah. There you go. Okay, the next question comes from Olivia. Your line is unmuted.
Hello, can you hear me?
Yep. Hi, we can hear you.
I was just making sure. It kept saying I was muted, so I'm like, I'm not sure. I have a forms question. So I'm at the MCO doing initial MnCHOICES assessments for potential EW, and we usually check the staying healthy section, and it says on here the notice of action and signature page will not populate then if we choose just the staying healthy. Are we allowed to use that notice of action or that assessment summary form if the MCO says it's okay?
No, if you work for a county and you're not working for an MCO, then you should not be filling out the staying healthy section. That is a care coordinator responsibility, and it has to do with billing concerns as well. So if you work for a county, you're not the care coordinator, then the staying healthy should only be done by the care coordinator / MCO. And
Right,
you do have to use the county forms, which is the NOA that's built into the system and the signature page.
And my question is, if I'm at an MCO and I'm doing a MnCHOICES assessment, can I use that notice of action form, or are we, as an MCO, are we allowed to use that notice of action if we're doing a MnCHOICES with someone?
No, those are county forms, so you need to use the MCO protocol, your own notice of action forms.
Okay, that was my question. I just wasn't sure because I love the form. I'm not going to lie. So I was like, I'm not sure. Can we actually continue to use that if we're an MCO? But you're saying no, we need to develop our own form.
Correct.
Okay, thank you.
Okay, the next question comes from Ricky. Your line is unmuted.
Thank you. I just have a clarifying question. My sound was cutting in and out when you guys were talking about the EWRS rate plan that was completed in MnSAP. And so my clarifying question was, there was guidance that said we could use the support plan with transition as the reason, but it was my understanding that that could only be used once the documents were retired, the legacy documents, and that's not slated until October 1st. Am I hearing you say that we can use that now, even though those, documents are still live through the end of September for MnSAP?
We would encourage you to do everything that you need to do in the revised MnCHOICES, especially that we are coming to the end of that transition period. But you can technically still use MnSP until 9:30.
Yeah, I think it would be easier to use the revised MnCHOICES with the support plan transition reason, but we just have been holding off because it said once the documents were retired. So if we have permission to go ahead and use that, I think all of the delegates would be much happier with that versus having to go into MnSAP.
Oh yeah, you can
So thank you.
absolutely use it now. I will say the only issue with using a transition plan is transition plans currently cannot be revised. And so if you need to make a correction after you've created a transition plan, you need to create a new transition plan.
Okay, thank you.
You're welcome.
Okay, the next question comes from Jewish Family Services. Your line is unmuted.
I'm just curious about the support staff role or like a case aid role that we have and their abilities. If they are maybe in that admin role to go in and update that doctor's letter was sent out or care plan letter was sent out, support plan, and making adjustments to those dates once that is fixed, I guess, with the doctor letter. If that's something that support staff can go in and adjust for care coordinators, or if other people are. That makes sense.
Yeah, so you're wanting that the support plan be able to edit you're wanting support staff to be able to edit the support plan.
Mm-hmm.
Okay. I'm not sure if that's a current permission. I'm trying to check our requirements, but if it isn't, you can send that in and we can request that enhancement. But I'll try to see if it's a current permission level. Let's see. I think they can edit the support plan currently. Looks like it. Looks like they can do that.
Okay.
As a support staff role. Are you asking specifically about an admin role?
No, yeah, we were saying support staff, so that helps. Yeah, I think it's, I'm not sure the difference, I guess, between the two, or what the title is in MnCHOICES, but yeah.
Okay.
Okay, so it looks like our next question comes from Katie. Your line is unmuted.
If you put in the wrong number of units, it makes you re-enter in the whole RS plan again. Is there any talk of changing that so you don't have to enter it in again?
You want to send that one in so we can take a look at it and potentially request an enhancement?
Yes, thank you.
Thank you.
Okay, so at this time, I don't see that we have any additional questions. I'll move us along in the PowerPoint, but if you have a question, just raise your hand and then we can spend a few more minutes at the end of the call. So I do want to remind you all that this is the last scheduled MCO and MCO delegate agency call in session. Since we're moving in the final, I mean, we're currently in the final transition period. We don't anticipate adding any additional call-in sessions, but we still offer and encourage you to attend the monthly MnCHOICES office hours calls. And so if you want to view the schedule, I think we have them scheduled through next June. But to view and sign up for the remaining office hours call, you can click on the link in the PowerPoint and then have the ability to sign up for the remaining calls that we have scheduled. As always, you can listen to past webinars or call-in sessions on the webinar archive page. And I did mention at the start of the call that the PowerPoint for today's call is already published. And so if you want to have those slides to reference, you can go out to the webinar archive page and search MnCHOICES, and you'll be able to find the slide deck for today's call. If you want to stay up to date on the MnCHOICES revision project, again, we encourage you to visit the MnCHOICES partner link webpage, and then also make sure that you're signed up to receive the e-list announcements. At this time, I still don't see that we have any additional questions. But I'll give it another minute. Okay, I see that we do have a hand raised. So Ruth, I'm going to unmute your line.
I am looking in the webinar archives, and for the session today, oh, I see it. I'm sorry. I was seeing the video coming soon. I thought that was the PowerPoint. So I'm sorry. Never mind.
Okay, yep. So you should be able to access the PowerPoint. It is published on there. The recording will come after this call, so you can check back for when that gets published. Trista, I'm going to unmute your line.
Hi, I have one more question about support plans. I know that the instructions we've been given are to close or update, revise the current support plan first before opening the next support plan at reassessment. Process-wise, I'm struggling with this because if we're encouraged to get electronic signatures at the visit, we would need to have that next support plan opened, but we wouldn't have the information we need to close out the prior support plan until we do that assessment with the person. So process-wise, I'm kind of struggling with how we would go about doing that.
Well, I just want to make sure that that I'm understanding you, because if there's the previous assessment is in an approved status, then that, you know, it's technically quote unquote closed. There's nothing that you need to do after the service span date or the support plan span date once it passes if you're not revising it. But as far as process goes, and the fact that you may want to revise it after you've started an assessment and a support plan, we do understand that that is a challenge right now with how the system currently functions, and we're working with our vendor on that.
Okay, is it, so if we open the new support plan and finish that first and then revise the previous support plan to update the goals that they were achieved, for example, after, is there something like behind the scenes that is I guess like gonna mess something up, or if we do it in that order?
Yes, there is potentially, I should say. So if somebody's needs change greatly, if their case mix changes, their budget changes, their assess needs, any of those things change, that information gets pulled from the new assessment. And so that is what's tricky about revising a support plan after a new assessment has been created and is in approved status. Because now that information will pull into the revised of the current span. Does that make sense? It's kind of challenging to verbalize.
Yeah. Yeah. What if we just take like full MnCHOICES out of the equation? What if it's just an HRA support plan and there's no, there's no like no budgeted services, I guess, that you would need to account for? Would it matter when doing HRA support plans?
Well, I think there's just a few items that I think is related to housing and employment that carries over, but I think when you go to revise it, it might still only, I mean, it would only revise the last support plan that was in approved status, but I don't know. I may need to look at that functionality to see how that would work.
Okay. Typically with health plan work, we have to close the care plan. So I think this system maybe just, I don't know if it's built to work with our processes like that, like what our requirements are by the health plan. And closing a care plan typically means we're updating the goals and saying whether they were achieved or not achieved. So that step of the process is where I'm getting just kind of hung up on, that we were supposed to do that, but we can't do that until we do the assessment. And then when we're at the assessment, it'd be nice to have the new support plan open to get their signatures. So it's just kind of mixed up, I guess, process wise when we're like in doing the real work out there.
Yep, and we understand. We've been told kind of how that process is working and how the system was built. And like Liz mentioned, we are working on having conversations with the vendor to see what we can do to kind of enhance that functionality.
Okay, so there's really no workaround for it other than maybe while we're at the assessment trying to update and close out that current support plan and then opening it while we're there.
Yep.
Okay, thank you.
Well, I would caution with that though as well, just because you need to select the care coordinator before you're offline. So it depends if you're offline too.
I typically we have mobile internet, so I usually do it all online, but that is a good thing to know.
Okay, thank you.
Thank you.
Okay, Kate, your line is unmuted.
Regarding the support plan type, oftentimes we find ourselves doing an assessment and it's geared towards EW. So we open an EW support plan, and then maybe 3 months down the road, we find out they're not eligible for EW, so it's going to go community well. And so therefore the support plan doesn't match. Is there a way or enhancement coming where we can just go in and change the type of support plan without having to discard and open a new one? Because then we lose signatures and all that stuff along the process.
There isn't. The way that the system was built is part of the vendor's core product, that the services are associated with the program type. So if you look at how it's built, it's program type and then services. And so it's not something that can be editable and changed because of the core product.
Okay. So would have to like redo it completely and send out for new signatures if they didn't go EW.
Well, if you're unsure of what plan that they're going to be on, you could choose to get hand signatures so that you could upload the hand signatures to the support plan. And therefore,
Would it be, sure, that, I mean, that makes sense too. I mean, at the time, they were, you know, pretty darn certain they want EW, but because of an asset or something, they just were determined not eligible and it's not possible.
Sure.
So we're not going to know that, but I wonder, is it possible to like print the signature page from the previous or the current support plan and then attach that to the new support plan because the dates are going to be kind of simultaneously the same?
I would like to ask and consult with other policy staff on that.
Okay.
So if you want to send that in, we can get back to you after I consult with others on that.
Okay.
Thank you.
Okay, the next question comes from Liz. Your line is unmuted.
Question. I had a follow-up question actually about the ongoing office hours. Up to this point, there's been the MCO calls like this one, and then the other office hours. And when we call into the other office hours, we're kindly but firmly told that those are for county questions. They're not for HRAs, they're not for HRA support plans. We need to wait for the MCO call. So if the MCO call is going away, can you talk about how the new office hours will be formatted? Will there be a time for MCOs to ask questions? Will the MCO staff be at those? What's going to happen in the future?
Well, yeah, I think the purpose of the MnCHOICES office hours calls is to answer any questions that mentors have related to the MnCHOICES, the revised MnCHOICES application, or currently if they're still in the support plan application. And so we have been taking MCO calls during the regular office hours calls as well. We just had hosted a few different MCO call-in sessions as new staff was MCO and delegate agencies were coming into the system. At a point in time, there seemed to be an influx of MCO specific calls because they were new to MnCHOICES. And so then we decided to add a few different MCO specific call-in sessions that just really assisted MCOs and their staff as they transitioned into the system. But I think the idea is that now we're kind of at the end of the transition period. We're having 100% of staff in the system. The idea was that we would just transition all users into calling into the monthly call-in session. So you're able to bring any questions you have related to the application to the monthly office hours calls. So they're not specific just to counties or tribal nations. They're for all users. Okay, so then the next question comes from Laura. Your line is unmuted.
I just had a couple of questions, and going off of what I think it was Trisha was talking about with the support plan when it comes to the renewal period. So is the expectation per the slide just to keep revising a support plan? There's never going to be a time really that we would create a new support plan as long as there's the MnCHOICES assessment active. Is that correct?
You always have the option of creating one from scratch. So if you would prefer that, you can do that by just hitting create new form instead of using the revise functionality.
Okay.
And there may be times where, you know, somebody's needs have changed so drastically that really their last support plan is just so outdated, or you did a new early reassessment because their needs have changed so greatly, their supports are changing greatly. you really don't see a reason why you want all that stuff to carry over, you absolutely do not have to choose revise. You can just
Okay.
create a support plan from scratch. Yep.
Okay, and then I'm not sure if there's someone behind me in the queue, but also another question related to that is that it said all narratives will like come over, copy over with clicking the annual reassessment option as the reason for the support plan. Does that include all of the goals and then the supports for the goals? Will that all be copied over?
Yes.
To the news? Okay. Perfect. Yeah, because I had done a help desk ticket and I just wasn't sure because there wasn't a lot of clarification in the response from the help desk ticket on the support plan and what it would look like upon clicking that option for annual reassessment. And also just from like an auditing standpoint of what Trisha was going back to, of just making sure, because we need to close out or mark the goals as achieved, and how that would look like if we're continuously revising for any current assessment from the previous span.
Well, and just because the goals and the supports carry over doesn't mean that you must keep them there. You can edit them and delete them or update them or whatever you need to do in the revised support plan. It's not permanent just because they copy over. Can certainly be updated in the new one.
Okay. So then just as like a last question, so when we have to close out the support plan, then are we still clicking the plan revision then? And then we'll then just in the reason for the plan revision, we can just say like reviewing goals due to like new reassessment in progress or something, because we're not going to click annual reassessment because that's for the current assessment, correct?
Yep, so any changes you need to make during the plan year or, to that plan that happened during the plan year, you would use plan revision. Yep, if you're needing to create a new reassessment at reassessment time, you use that annual reassessment function. And we didn't actually talk about this today, but as you can see on the screen, there's initial listed there as well. That is also on purpose when for like somebody who actually fully exited the waiver, but maybe went back on it shortly thereafter and are going to be returning to the same services or similar services, and a person wants those services copied over. That's why the initial is there.
Okay.
Okay, the next question comes from Kirsten. Your line is unmuted.
Thanks. Going back to Kate's question, a couple of raise my hand right after, but there's more in there, so I know it's circling back. But I was wondering if it had been thought or considered with someone having EW as that support plan, and it's been kind of created, and then they decide not to, or they're not able to. What, if anything, would be the harm of just adjusting or revising supports in a revision of that support plan until the next assessment versus completely terming it and starting a new support plan? I'm just wondering, like, is there anything from a reporting standpoint or anything DHS required wise that would need to be done if there weren't other like health need changes other than not being eligible for EW? Like, can that support plan serve as that support plan for the rest of the date span until the next one? That's the question, I think, been posed.
I think from a data integrity standpoint, we wouldn't want to see that happen. You know, there are also other concerns because the services for EW would be available when they shouldn't be available for the care coordinator, case manager to use. But as far as the support plan itself is concerned and requirements, the MCO support plan and the HRA support plan, for instance, are very similar. So I would say it's more of a data integrity reason.
Okay, yeah, we'll have to maybe explore that a little bit more, and if there's something more specific, we can shoot that in.
Thank you.
Thank you.
Okay, the next question comes from Ricky. Your line is unmuted.
Hi, thank you. Sorry, I have so many questions today. So I have a question in regards to the EWRS rate plan. So for example, I've completed an assessment. Let's pretend I did it in the revised MnCHOICES application in thinking the person wanted elderly waiver services. However, at the time of the assessment, they were not looking to implement or move into a, let's say, customized living, or maybe we hadn't found one yet. Is there a time limit on how long that assessment would be good for me to use to create a new EWRS rate plan? Is it the year, or as long as they're open to the waiver? Or is there like a time limit of, you know, whether it be 30 days or 45 days? I, for some reason, recall a long time ago there was some sort of rule with the time span, but I was just curious with the revised MnCHOICES if there was any time span limits, and if we did go and add that, then would we do that by just doing a functional needs update and updating the support plan?
So the question is if they went on EW, right? But they weren't moving into customized living, can you add it later and do the RS tool? And is there a time limit for that?
Yes, so that's one of the questions.
Okay, so no, you can either, you would close your support plan, you know, after you've finished it by moving it to an improved status. And then if a later date, 90 days, 100 days, whatever, they want to move into a customized living, then you do plan revision and add that service to the support plan.
Okay. And then I would only do the functional needs update as if, let's say, I needed to determine 24 hours versus non-24 hours, and there was like a change that way. Just trying to figure out when we would do just the regular plan revision versus like a functional needs update.
Oh, well, the functional needs update is used for if there's been a change in needs or you believe that there's been a change in case mix. But when you're doing that, it doesn't reset the span.
Correct.
And so many people choose to do an early reassessment instead of a functional needs update. But a functional needs update isn't necessarily required just because somebody's choosing to use a service such as customized living. However, if their needs have changed so that they need that level of care, then it's also an option.
Perfect. Thank you.
You're welcome.
All right, I don't see that we have any other hands raised at this time. So I think I've gone through these slides. And so I do want to say thank you for joining today's call. If we didn't address your question or if you have questions after this call, please use the MnCHOICES Help Desk form, which is the 6979, and we'll be sure to respond to your question. We are going to end today's call, so Alan, you can please stop the recording. Thank you.